Well, good afternoon, everyone. So my name is Vanessa Perry DeReef, and we are here from the City of Chicago to discuss the community of practice and what we are doing in the City of Chicago to address the violence that we see in our city through the Metropolitan Peace Academy. I have the honor of serving as the Director of Training at the Metropolitan Peace Academy, and sitting to my right, we have Dr. Troy Harden, Brother Billy Deal, and Rodney Phillips. We will all introduce ourselves a little more in depth as we talk about what we're doing in Chicago. As we move forward, I would like to discuss the overview and what we will discuss here during our presentation. We hope to talk about how we are professionalizing the field of street outreach in Chicago and bring greater awareness around that. We also hope to discuss just exactly how we are going through the different efforts to bring greater awareness around the field of street outreach in Chicago, and then how we are using the Metropolitan Peace Academy and presenting it as a community of practice to bring and build community with the street outreach workers. Finally, we will talk about the different innovative practices that we are using in Chicago around the field of street outreach. At this time, I would like to turn it over to my brother, Dr. Troy Harden.
Awesome. Thank you, Vanessa, and welcome everyone. My name is Troy Harden, and really excited to be here this afternoon to share some of the work that we've been doing in Chicago around to address violence and build peace in communities. So I wear a few different hats. One of them is I'm currently, and how I really got here is I'm at Texas A&M now. I'm the director of the Race and Ethnic Studies Institute and faculty in sociology. But my roots and where I'm from is Chicago, and I've just been down here a couple of years. And one of the things that we want to do is continue to support the good work that's happening in the state of Texas and Houston and in Harris County. And so thus, we thought it might be important to share a little bit about our history with the Peace Academy, as well as the impact of that work. And so we want to tell you how we got here and why this work is really important in this way. As you all know, the efforts around violence, have increased around the country because we still see ongoing violence in many of our communities. I think one thing the conference has done is really create a comprehensive picture to understand that we need all hands on deck to address violence in so many areas. Unfortunately, what we've seen historically is the difference between what we call a carrot and stick approach that we hear people talk about around crime and justice issues. The stick approach ultimately is if people violate, if people are doing harm in the communities, we need to just lock them up. And that's the way to address it, is to move into increasing policing and or efforts to incarcerate and punish people. However, more people say we need to use more carrot initiatives, which look at how we can both prevent as well as intervene when harm happens. And so we believe this effort is an important step in the approach to decriminalize, not just decriminalize the work, but also increase the capacity for people on the ground to do the work in a very important way. And we borrowed this model in many ways from the efforts that was happening out in Los Angeles and in LA County. Some of the work that occurred out there really looked at, how to increase this idea of credible messengers really doing the work, but really found that there was a harsh critique amongst those who had either been formerly in the life or had been formerly incarcerated. And we would see where through either media pressure, there'd be 1,000 successful outreach workers and one would recidivate or something would happen and then funding would be pulled. And so there wasn't a extensive commitment for the field and to really be able to support the efforts. And a lot of it was based on, there was a bias and a stigma associated with those that had formerly been in the life or may have been involved in street organizations in the past. But what LA did was they worked towards professionalizing the industry, saying that there's a set of standards that we can begin to develop and create a level of consistency amongst those who work, even the pathway towards leadership amongst those who work in the field. And the results speak for themselves. They saw a significant increase in violence. and an increase in those who were might have been formerly incarcerated or formerly involved in different elements, move into a place of leadership in a very positive way. And so thus the development of what was called the Metropolitan Peace Academy, as well as the CP4P model, which was the Communities Partnering for Peace in Chicago. So we can go to the next one. And so a fundamental part of that is this idea of partnership development, is really being able to bring different people across the table. So in a nutshell, what the Peace Academy built on was several organizations working to address violence in some of the more high-risk communities in the city of Chicago. You know, Chicago has a strong reputation or a history of violence, but ultimately, it's also had a history of organizations working to address those. But historically, that funding for those organizations would go and come and go and come. And so we needed to create some consistency over a period of time, long-term sustainability for the work, and also increase the capacity of people to be able to do the work in a good way. And so we leaned into understanding what were some of the best practices in the field associated with addressing violence, including development of the public health model that we all know about and we're increasingly gaining our knowledge about, trauma-informed care, restorative justice, as well as what we call a hyper-local model that really looks at addressing things from the ground up, you know, as opposed to someone coming in on high and saying, I know what's best for this particular community or what's best for this particular neighborhood. We really ask the question, yeah, even though we're moving off of this public health model, even though we're moving off of this trauma-informed model, what's really indigenous to this particular community in terms of how we develop it? So that became the cornerstone for our work and our work in developing the Peace Academy. We wanted to bring together what were some of the best practices that happened across the country, including things like Cure Violence and the Urban Peace Academy in LA and the Institute for Nonviolence and the best of trauma-informed care, and also match it with those things that were unique to Chicago, including the history of some of these efforts, but the history of even how street organizations developed in Chicago, the history of Chicago politics and how it influenced crime. And one of the reasons we felt that it was important to do this was because we couldn't be credible with the people in the audience unless we told the truth, unless we really dealt with what was this true history of Chicago, which includes the politics associated with street organizations, but also historically with being able to interrupt violence and also interrupt the funding for that. So we have real honest conversations about that history that would lead to then talking about what kind of future we really wanted to develop together. All the partners had one thing in common, which we had our own North Star, were on the same page about our North Star, which is ultimately bringing peace to communities. And from that angle, you know, one of the things that I went around and did as one of the lead curriculum builders was I went to every organization in the city, even some of the folks at the table right now, and just really listened to some of the things that they felt were important to develop in the process. And as a result, we were able to get people on the same page from across the city, from across organizations, from across race and ethnicity, even from across street organizations, to really agree on what we needed to do moving forth. And as a result, you know, we built what we consider to be a beautiful process. Go to the next slide. And ultimately, I know what people want to know is what the impact of that particular work was. The CP4P model targeted the most high-risk areas in the city, what we consider to be the places where people are most vulnerable to be shot or to shoot. And what we see over the course of these few years since it's developed, even though we see that crime has gone up in some other places in the city, for the areas that the CP4P model and ultimately the Peace Academy impacts, crime has went down on an average of 1% every month for over 24 months now. So the average result is a 17.7 decrease in homicides and shootings in that particular area. And so the results speak for themselves around where the work is happening. And we give a lot of credit to both those street outreach workers who are on the ground, who are doing that work, as well as even you'll hear from later today our field managers who've been doing a lot of work to really create that space that, one, they can build on the best practices associated with being a credible messenger, associated with dealing with street outreach, associated with violence interruption, associated with trauma-informed care, but then also create a space where there's a strong network and a powerful network of folks, who are working together to address peace. I'm gonna turn this back over to, and you can look that evaluation results up. Andrew Papachristos out of Northwestern was the independent evaluator, has been the independent evaluator, so you can feel free to check that out on your own. I'm gonna pass it back over to Vanessa.
Thank you, Troy. So I wanted you all to think about this as professional development for the street outreach field. When we thought about this vision of the Metropolitan Peace Academy, we wanted to make sure that we created a safe space for adult learners with all the different literacy levels, with all the different lived experiences. How could we ensure that skills transfer happens? Because at the end of the day, in a training, you want to make sure that if you're a part of a professional development cycle, that skill transfer happens. And so when we sat down to create the curriculum, it was very important that a community building element was present. Not only present, but it really lived throughout the curriculum. So every day that we open at the Metropolitan Peace Academy, we check in with the 25 different men and women who are sitting with us. And so the check-in and the icebreakers and the established norms, it may seem kind of rote. However, it's very integral to making sure that those people each and every day who are giving their lives and their time and committed to remedying community violence, that they are practicing not only self-care, but someone is checking on them. Someone is creating a safe space for these conversations to happen. And so as Troy spoke about, talking about the best practices and the strategies, we wanted to make sure that the conversations were authentic, that those in those particular circles felt protected, felt safe, but at the same time that we recognize the value add that they bring to the conversation. So in creating the curriculum and creating the space for the Metropolitan Peace Academy, it was very important that those who lead the work, those who are doing the work on the streets, are actually leading the work. So one of the models, or one of the parts of our model, includes that the graduates from the Metropolitan Peace Academy become the facilitators. So in addition to our subject matter experts, as I see Brother Benny Lee sitting in our audience today, in addition to the subject matter experts that stand before the cohorts, we also have graduates from the Peace Academy who return after receiving training, and they become facilitators. So you're actually learning those best practices and strategies from individuals who have walked in those same shoes, who have similar lived experiences, and who have been students at the Academy as well. So it's really important when we're creating this community of practice that the community is really important. It's not anything that can really be glossed over or anything that's rushed through, because you have to take into consideration the adult learners who are in the room. So we talked about creating this professionalizing the field of street outreach in Chicago. As Troy talked about, we had to make sure that we had relevant meat on the bone, not necessarily just real static, but some sort of information that was flexible. So since we started at the Academy, we've added additional lessons to the 18-week curriculum. Over a course of 144 hours, not only do we talk about the best practices and the strategies associated with the field of street outreach, but we talk about the people. We talk about the people who do the work. They see a lot of trauma. They have their own personal traumas. And so not only is that a think tank for the experts at the table, but it's also a place where they can do some healing work, some mindfulness, and really get to the root of maybe some of their own personal traumas. And so in order to uncover that, you have to create a space of safety. You have to create a space that's built with trust and collaboration, and that's where the trauma-informed approach comes in. And so since our inception, since we started in January 2018, we just launched our 10th and 11th cohort maybe 2 or 3 weeks ago. And so the demand for the work has really grown, and what we see as a result of the training, we see a lot of our graduates go on into leadership positions. They're leading either their own organizations, or they've been promoted to leadership positions within their organizations that they're currently employed with, or they've even gone on to other roles in the state, local, and city levels. And so we are just here to highlight the best practices and strategies, and to highlight just exactly how we created that. And so I want to talk to you about the community of practice and how we evolved into this community of of practice. And there are three particular elements that we find when we talk about the community of practice. The first one being, the domain. The domain really talks about the expertise. What is the realm that we are focused on? What is the specialization of this particular group? And in this context, we're talking about the field of street outreach. And so this group of people, they convene together regularly to talk about the best practices, the strategies, the new learnings around this particular field. The next concept that's associated with the communities of practice would be the community itself. And so who are we? What do we subscribe to? What do we uphold? And then what are the standards associated with us in this particular community? The one thing about the community of practice that really lends itself to the learning at the Metropolitan Peace Academy is that everybody at the table is an expert. Despite and because of your level of understanding, despite and because of your expertise at the table, you are respected, you are applauded, and you are welcomed at the table. And then finally, we have the practice itself. The practice itself represents those artifacts. As a result of the community meeting regularly, as a result of this domain coming together and talking about this particular realm, what are we creating? What is the evidence? What are the standards that come into play as a result of us meeting regularly, as us coming together as experts, talking about the field of street outreach? As a result of, since 2018, I think after our first cohort, we created the Metropolitan Peace Academy Professional Standards. So now we have 14 standards of expectation around street outreach in Chicago. In addition to that, we have created 10 competencies. And when I say we've created that, it's a collaborative process that doesn't just come from the structure. I'm the structure behind certain things. However, the voice and the value add come from the street outreach workers. They come from the graduates of the academy, and they were the ones that helped put together these standards of practice that we have currently at the academy. And so we're very proud of what we've created. We're really pleased at how flexible that it is, and that it really captures the voice and the value add that street outreach workers have been doing, have brought to the city for many years, even before we were created. And so with that, I'll turn it over to my brothers, Billy Dill and Rodney Phillips, and they'll tell you more about the innovative approaches that they've implemented in Chicago as well.
Thank you. My name is Rodney Phillips. I'm a field manager for Metropolitan Peace Academy, and I've been doing the work for like 12 years. The field manager and some of the practices we use that we have fused together. We used a nonviolence approach and the public health model. You know, the public health model is a proven model that's been evaluated by such entities as the DOJ, Johns Hopkins Association, and things like that. It's three strategies. The first strategy is you intercept and detect. Basically, you grab credible messages from the community, people with lived experience, and people who are respected among their peers. Use the boots on the ground approach to stop killers and shooters on the front end, because those who's from their community knows their community best. And this is developed by having relationships with the higher risk. The number two strategy is that you treat the highest risk. This is done by outreach workers. This is the outreach worker approach. Since the public health model treats violence as a disease, you know, you treat your highest risk. Number three is we change the norms, and we do that through community mobilization, where we get clergy, business owners, you know, and any community stakeholders to come together to mobilize, to get the message across that we use it as like social pressure to say like, hey, violence ain't good. I remember doing the work with Ceasefire, and one of the biggest things was our pub ed, and the pub ed was, you know, don't shoot, I want to grow up. And that poster and picture they had of the young people saying this was very captivating, and it spread it across. You know, you got to mobilize the community. But you know, it's different approaches, and the Peace Academy where I'm at, we bring everything together. You know, we don't believe it's just one way. We infuse them all together. You know, I've been doing this work over several communities in Chicago. I worked in Inglewood, Greater Crane Crossing, all over the South Side. I'm a field manager for Zone 1. Zone 1 in the community, we broke it down to 5 zones, the Metro Peace Academy. It's just that it's different approaches, but I believe that the people who, like Vanessa spoke on, the people who are most affected by the work, can relate to the target population a little more. And that's where the credible message come in at. And the guys with LTO, meaning that's abbreviated for licensed to operate in the community. So it's just, it's not one approach, but it's a combination of things that we can do to keep our community safe. And I'll pass it on to Billy Deal.
All right, good afternoon, everybody. All right, I want to talk about I'm a field manager for Zone 4, which covers a large part of the west side, the Austin community, North Lundale now, West Garfield and East Garfield Park. I want to talk about the dangers and why violence interruption and prevention and street outreach is dangerous work. You have to make sure that you get the right people to do outreach workers. When you find people trying to get these jobs, everybody claims that they're somebody. But not everybody has that LTO, which is that license to operate in those communities. So you got to get the right people because we all depend on ourselves. We depend on each other while we're out there in the field. The targeted population that we deal with, they're not very inviting. So it's not easy to get inside of their world. So you have to be somebody that they trust or somebody that they know that have walked those same shoes and lived the life that they live, which is why the majority of outreach workers are people who come from that community. I started out doing outreach work, and it was my first time doing it. So we went out to a field, my brother, I see a few people out here who actually did the work with me, like my brother Dion, my sister Nicole, my brother Benny Lee, who inspired me, my brother Chico Tillman, who inspired me. And we were out at an event. We were searching for a dead body that had, they had ran from the police and they drowned. So we were out there searching for the body. I'm out there with my coworkers who's supposed to have influence over certain people. And while I'm out there trying to work, it was some people that knew me from my past life. And they said, why you got him over here? And it made me feel kind of threatened because the people who I was with didn't speak up. So when I got ready to speak up to try and defend myself, they told me to just be quiet and get to the back. From that point there, I went back to my supervisor. Dion was the supervisor then. I let him know what happened and how I felt. And I told him we have to get the right people at the table because our lives is at risk every time we're out there. Street outreach is dangerous, very dangerous. I've seen outreach workers, several outreach workers that I've known personally that were shot while trying to mediate conflicts. We've had outreach workers killed on the job trying to save lives. So we have to make sure we get the right people hired, and we have to make sure that we take this work serious. All right, I want to talk about the importance of getting credible messengers. Now, like I said, everybody claims to be somebody. Everybody is not who they say they are. So we try and find people who have lived that life, people who have cosigns or stamps from people who are out there living that life now. That's the best way to get it. You know what I'm saying? Who better to touch the people than the people who actually live their life? Another example of credible messenger. All right, now, back when I was growing up, social media didn't exist. So if I had a problem with somebody, we had to deal with it in the streets. Now, social media made the game 100 times worse because with the click of one button, you can reach millions of people, and that makes something happen. So what we do, we strategize, we use different strategies on social media. Our outreach workers monitor pages. We monitor the pages of our participants. Anything that looks like it could be brewing, we get on those phones. We try and reach out. We try and mediate those conflicts before they even get started. We also use people like myself who have large social media platforms and followings to give positive messages, inspirational messages, and actually show the work that we're doing out there in the community. We use other big name artists, comedians, actors, and things of that nature to touch these people as well. So I think that we have to make sure that we target social media. I think with the help of social media, getting on top of that social media, I believe that we could bring the violence, those numbers down by about 50%, because the majority of these beefs start on social media and they start from nothing. We've been out there on the block and we asked these guys, what you into it for? Well, he made this post. Okay, what did he say in the post? Oh, he's talking about this, he's talking about that. And nobody's there to monitor and get on top of that. So we got to make sure that that's implemented in those strategies as well. It's therapy, not just for the participant, but for the outreach worker as well. You have no idea how it feels for me being a 6-time felon, a person who's been to the penitentiary for robberies, drugs, shootings, and everything, to change their life and go out there on those same blocks and hear people say, you motivate me every day. Or to hear people say, I know change is possible because I watch where you come from and I watch what you're doing now. That's therapy. It makes me feel good and it makes me go even harder. You know, I feel it's my job and my obligation to help give back to some of those same communities that we helped tear down. One guy told me this, and this made me go hard. He said, man, you motivate me. But since your name is Bo, I'm gonna say you motivate me. You know? And I took that phrase and I ran with it. And I started motivating, I continued to motivate the community. I continued to use my influence and my connects with artists like Lil Wayne, Waka Flocka, Gucci Mane, Mike Epps, and things of that nature. I got them to come and give me these drops and got them to stand next to me to inspire these shorties, to show them that change is possible. You know, we just have to want it. And it's our job to stay on top of them and make them see that and make them want that. So to close my section, I'm gonna end it with one word: motivation.
Thank you, good people. At this time, we'll take questions. She's going to go get the mic.
Thank you. Good evening, ladies and gentlemen. My name is Lee Clark. And my question is for you, Vanessa. First of all, it's an honor and privilege to be counted among you, ladies and gentlemen. In which policy, procedure, or standard that you go by choosing in which program y'all decide to work with, as well as individual programs and incorporated programs such as Harris County?
Brother, can you repeat that? I'm not sure I'm understanding what you're saying.
All right. And what procedures do y'all take when y'all choose which program? Because earlier you mentioned the programs y'all be working with. What procedures do y'all take when y'all choosing which programs to partner with?
Or with organizations?
Right.
So we support Communities Partnering for Peace. They came together in 2017 and they represented 8 community-based organizations across the city of Chicago. And so those organizations, they take 2 of their outreach workers every 18 weeks and they send them to the academy. That's how we create our cohorts. But since I think maybe 2 years ago, we now partner and support more than 12 community-based organizations, and so that's how we decide who we support and who we work with. And then additionally, we've received new partners as a result of additional funding, and so partnerships follow money, and so that's how we determine who comes to the academy as well.
If I can chime in too, I think part of it is yes, she's right, the partnerships follow the money, right? But there's another part that says, like, first, who's doing the work, right? And where the work needs to happen. And who's, going back to what Rod and Bo said, who's credible in doing the work in where the work needs to happen? And then, do they have a willingness to be a part of a larger collaborative effort? There's an old African proverb which says, when elephants fight, it's the grass that suffers, right? And everybody's not always willing to come together to really be a part of a partnership. Some people want to be lone wolf and do what they do, and that's cool. But we know that this is an effort that is all hands on deck. And so people have to be willing to come together and in that spirit. And so that's how we started. It hasn't always been perfect, you know, and there's been conflicts and ups and downs and things like that. But that's why I think the importance of the Academy is critical, because in that space, it becomes a space where even people, maybe their EDs might have differences or issues around funding. When everybody comes together and says, you know what, we all in this together, we all trying to figure out, you might be on the west side, I might be on the south side, but we got some of the same issues. You know, we come from some of the same issues. It becomes a very powerful piece, you know. And so I just want to add that around the partnership piece.
Yeah, and I just also wanted to add that, you know, for so many years, the work was being done in silos. Like we're doing over here on the north side, we're doing on the south side. But the beauty of the Academy is that it brings everyone together and we can create this collective effort. And so that really helps to deal with situations in the city. I think during the pandemic, we really saw the strength of the collective. We had some issues going on the west side in our black and brown communities, but because they had been in the Academy together and we had built that relationship and built community over the course of 18 weeks, we were able to get on the phone and pick up a phone and, you know, go into the communities and, you know, kind of quell that situation that was going on because we had established those relationships.
Can you all hear me? Okay, good. So we do have a question from online. Dr. Camille Gibson wanted to know, where can we access data on outcomes regarding the Academy?
Where can you access outcomes, the data?
Regarding the Academy.
Yeah, so if you go to the Northwest Neighborhood Network website or Google Andrew Papachristos or even Metropolitan Family Services, MPI, Metropolitan Peace Initiatives, you'll be able to see that same stuff that I showed earlier. If you did your phone to the link, it'll pull up as well earlier. You know, I don't know if we can go back to that slide, but yeah, so that data is available. Yeah.
As I've been in the conference, it seems like there's been a lot of new initiatives here in the Houston area. Y'all were just talking about some of the obstacles that y'all encountered, right? When y'all were talking about going from the silos to a collective, are there any other growing pains or lessons along the way of becoming a stronger organization that you think would be good wisdom to share, especially with those who are leading initiatives now here or have been for a short time?
That's a good question. I would say remain open. One thing that, and I would just speak for myself, that I thought was too much, not too much, I didn't think we had enough voice from the Latino community and with our curriculum. And so it was very flexible. And so now, as a result of one of our field managers recreated this lesson, more lessons. So it's not just focused on one particular community, but it's very flexible that it supports black and brown communities. That was very important. So make sure that you have that lens and you have those relationships where you can have those honest conversations about curriculum and curriculum needs. Where are your gaps? One good thing that I think is a good practice that we do at the end of the 18 weeks is that every cohort member has to sit through an exit interview. And at the end of the exit interviews, we ask them, is there anything else in this curriculum that you think that we should include? Because that helps us to tune our own selves and tune the curriculum. And so that really helps to determine what else needs to be implemented. Since our inception, we've included not only the lesson around the history of Latino gangs, but we also included the more female voice. You want to make sure that it comes from all the different aspects of who've impacted in this particular work. And then lastly, I want to make sure that I highlight it has to be very, very flexible, meaning that you should be able to take your training from one space to the next. We had to shift to the virtual platform, as many of you did, I'm sure, during the pandemic. We didn't really stop. As a matter of fact, because of the demand for the work, I think our training was more accessible, and so we were able to train outside of the city of Chicago virtually. So we actually created an external cohort, individuals from East St. Louis, Illinois. They became our first external cohort. As a result of the pandemic, we were just training online. We were able to kind of capture and reach them as a result of that. So remain very flexible in your curriculum, in your ideas. Make sure you have a lot of people that represent all the different vantage points so that your curriculum is relevant and it stays relevant. It's very flexible to meet the different communities.
You know, because, you know, she mentioned flexibility in the pandemic, because folks have been trained in the public health model, it made a lot of sense when the pandemic hit to really help support and help think through some of the strategies around, you know, addressing, you know, and bringing attention around COVID and, you know, best practices in that way to a lot of people in communities. So I think a lot of outreach workers were able to see how their skill set that had been developed in the context of violence also transferred over, which is very important for us, because one of the things that we were very intentional around was the lack of leadership or the lack of opportunities for leadership for people who had either been formerly incarcerated or had been involved formally in activities and had risen up into work, and how in many ways the leadership didn't always look like us, right? And so how do we grow that process, you know? And some say through the professionalization or through education or even through access to network opportunities. But we want to ensure that the Academy would be a place to really hone and develop professional goals, as well as skill set to be able to move to the next level. And I think we were able to really figure that out, but I think still it took time. It took time for the city to catch up with that, or some of the people to catch up with that, and so we had to suffer some of the consequences of that. You know, so I would say as a lesson, an important piece is that as the work here grows, one of the key things is really finding opportunities, finding those grassroots leaders who may not have had the organizational lead in the past, or maybe he or she hasn't got their degree yet, but creating an opportunity and a pathway for them for leadership and capacity building to really develop their own entities. We think that's an important and critical piece. You know, I think it's something, you know, you have Dr. Chico Tillman here, and he's helping lead some efforts around the country, you know, to develop some of that capacity and leadership for those who are leading violence intervention organizations. I think that's mission critical, you know, in this work.
We do have two questions from the chat online. First one being, how do you overcome politics and partisanship to work between state, city, and county governments, I'm assuming. So the question is, how do you overcome politics and partisanship to work between state, city, and county government?
You want to say something? That's on us. All right,
That's above my pay grade.
We deal with the field.
Well, you know, I think part of it was some of the work, again, that you all are doing here is really getting city officials, state officials to understand the importance of a public health approach versus a criminalization approach, you know, to addressing the issue. And historically, that had been an issue and a problem in Chicago. But there was and initially the funding that really came to develop this model was private funding, but we knew that wasn't sustainable, and it's not going to be sustainable. There is a responsibility for cities and states, you know, to really engage in public safety in a new way. And now we're starting to hear that rhetoric more and more cities and more work around the country, and including right here. And so that's a big part of it, is everybody being on the same page, continuously getting educated about what is public health, what's truly working around public safety, best practices like this and other practices that are happening even in the rooms next to us, that are working to improve and transform communities, and allowing those communities to really work, or those organizations and entities to work for a period of time and support them. We can't just fund for a year and expect all these results to change. We're talking, we want to change things in 4 months that took 400 years to create, right? And so it takes time to really be able to implement, to grow leadership, to grow the capacity, to really create transformation and change. And truthfully, the other public safety in terms of policing has had a long time to show that it works or it doesn't, right? And we see the results in our communities. So we want to take a long-term effort to really growing a new kind of leadership that really changes our community, as we all have the same goal in mind.
Got it. Thank you for that. We have another question from the chat. Do the initiatives for the individual communities vary based on the demographics and the specific needs of the community? Do the initiatives for the individual communities vary based on the demographics and the specific needs of the community?
You want to take a stab at that?
Yeah, I'll take a shot at it. So I know with certain models, you got to have specifically the right partners and the right communities for the program. It's like, say with certain programs, you got to have a collaborative, and y'all got to be on the same page and the same goal, So every community partner can't partner with the public health model, because the public health model may be based on certain things like with credible messages. In terms of being credible, you got to have guys who have relationships or might in a different lifetime have a different respect and stick to certain codes. But certain communities certain organizations may not embrace that. So you got to pick the ones who's willing to work, who's able to collaborate and bring people who would normally be at the table, and they're able to hear them out and hear the people out who most affected by the violence and who had the lived experience. It's just being able to be open-minded. So you got to have the right partner and different entities to be open-minded with the credible messages and the guys with the license to operate.
Got it. Thank you. I have one more question online, and then we'll go to the person in the audience. How do we get the everyday citizen involved in the process? Often they feel disenfranchised or not qualified to be a part of the process when they are the very core of the process. How do we get the everyday citizen involved in the process? Often they feel disenfranchised or not qualified to be a part of the process when they are the very core of the process.
Canvassing is one way to get the people involved. A lot of organizations, we used to canvass a couple days a week, a couple of hours each day, going door to door, letting the people in the community know the work that we were doing, and what we were doing, how often we were doing it, where to find us at. And we would also throw events like Night in the Light events, where we would bring out food, sometimes jumpy houses and things for the kids, and put them in parks where the kids didn't feel safe playing. And when we were out there, the park is filled. People are coming out eating, the kids are playing, and when we leave, the park dies out again. So just doing more of that is a great way to get the community involved in what we're doing. Once we get the community to buy in, things move a whole lot smoother for us.
Thank you.
So Bo referenced, the canvassing piece. A couple of the sessions that happened, for example, at the Academy, what we call asset-based community development, ABCD, right? Which is a model that looks at the unique strengths and assets, not of just, certain people with degrees and things like that, but everybody, right? That everybody has unique strengths and assets. And so certainly we talk about that amongst ourselves, but ultimately everybody in the community does. Even people who we may not think, are, connected or involved or supportive in certain ways, they are, right? And so in doing that, we're able to identify both the people, the places that you may not normally think of as being a spot that magic and powerful things can happen, right? Places and or even people, sometimes a lot of major things happen on Big Mama's porch, right? And these other spots, and so it's being able to identify that, and some of that happens through the canvassing, right? Through getting out, going to different events, going to different block parties, clubs, whatever, to be able to make that happen. So that's how you get the everyday citizen involved. We have major class issues sometimes even in our own community that separate and keep us from actually being connected. And so those who might have previously had credentials, sometimes they'll say, well, how does this person who has this LTO become more effective than I am? And part of it is because they're being authentic, they're being real, they're being connected in a very real way. And so even when people come to the set, we automatically say, bring who you are, be authentic. Even in the academy, that's even people, be the message that you bring. You talking about peace, you talking about healing. Well, if you don't look like a healer, right? Then you need to, So that's a critical part of what we do and how we bring it. So, yeah.
I had a question about the training program with the academy. It's 18 weeks. So is it, do the individuals, are they required to pay for the training, or is it provided free to them? And I'm kind of did the math on it, so that's 8 hours. There will be 8 hours a week.
Yeah.
So, you got to really be motivated to go through a program for 18 weeks. Are they doing 8 hours, or how are you all doing? I just kind of wanted to get a little bit more information about that 18-week training program, and then I had a couple other questions in terms of liability.
No problem. So the organizations are funded, and that's how they send their individuals to the academy. We actually have 4 graduates from the academy here now. We had our second cohort was 8 hours, and Brother Dion was a part of that, and he can talk to you about how that was. And then what we do, we meet twice a week, 4 hours a day. And it's a wonderful experience for everyone involved. And so that's the rhythm of the academy.
And just so the organizations really have to be invested in the development and well-being of their staff, really, because they're taking 8 hours a week to invest in this particular piece. So obviously they see the importance of that, right, in terms of how it's developed. So, yeah.
And the experience and the thoughts from the graduates is really what sells the program. When we started the first cohort, it was a grant-funded program. We're going to try this out. We want to professionalize the field street outreach. And then we went on to cohort 2, and then just kind of kept going, based on the demand for the work and the feedback that we were getting, from the outreach workers themselves. That's what, the most important thing, to making sure that not only are we going through this training, but that we're actually doing something with it, personally and professionally, is the value add of the academy's training.
We have time for one more question.
Just another question, because I know that someone mentioned about fatalities, and I was thinking about that in terms of, I would imagine that there would be possibly or potential fatalities in that kind of situation. So are these individuals who are the trained outreach individuals, are they working independently? Are they working for an organization, so they are insured by the organization, or how are we dealing with the risk factor and risk management in terms of that?
Yes, they work for an organization. They do work for an organization.
Okay. So that organization is dealing with the risk management aspect?
Yes. Professor, you want to talk about that, or Bo? They actually worked for a community-based organization.
Oh, okay.
Yeah, I mean, it's no way to really protect you from that, because at any given time while you're out there, I always preach to our team that we have to have each other's back. So if things don't feel right or you don't feel safe, don't do it there. But we have to meet the participants where they are. So we meet them where they are, but we understand it's a dangerous job. But the life we were living was just as dangerous, if not more dangerous. So, to try and get back out there and give back and save some lives, sometimes you have to take that risk. It's all about what it means to you. And to me, I made enough money to move out the hood. But I feel bad because I want to make sure that the hood is a safe place for your kids, your grandchildren, my kids. We want to go back to visit our family and things of that nature. So it's a risk that we take, but we take it. So I just want to let everybody know, when you see outreach workers out there doing that job, respect them, acknowledge them, let them know that you appreciate the work that they're doing, because their life is at risk every day.
I just like to say this related to that. Like, you spoke on the 18 weeks. One of the things that we cover, and we cover it a lot, is safety protocols. That's why the outreach workers is trained on safety protocols, because safety first. That's why it's important when you go in these communities that you hire the credible measures, the LTO. This is just not saying these is real life things that's happening. If you hire somebody, you got to make sure that he's credible. So you got to pre-screen him. You got to make sure that he say he know that community, he are who he say he are. But it's a lot of safety measures like uniforms and things of that nature. Being in twos and fours, not doing things by yourself. And we constantly have to remain outreach workers, because a lot of people that do this work, we street guys and we have egos, so we think we all good and we could go everywhere, but you got to be transparent. If you can't go over there, say it, because you can put the team at risk as well as yourself. So we do a lot of safety protocols on it.
And because of the work that they do, the context of the work, you think about, how do you train them? Like, how do you prepare yourself and create this space where the skills transfer, as I said before, happens? Because of the anxiety that comes along with the job, what they face each and every day. And so some of them come to the academy tired because they may have just gotten off work. Sometimes you have to shift your lessons and actually sit in a peace circle because someone may have just come from a very violent scene. And so it's really important that you stay in tune and understand the context of the work that they do, so that when they get to training, it's not always business as usual, but it is. And oftentimes that business also looks like taking care of the people who are doing the work prior to talking about that work.
At the end of the day, our work is about extending life, right? Extending Black lives, brown lives, and even going back to what Jealous was saying earlier, extending all lives. So I think we thank you for the opportunity to be able to share with you all today. So thank you. All right.
We had another question.
Have we had another question? Do we have one more question? I'm sorry.
There's one more question.
Okay.
We're going to be transitioning back to the main room after this, so this is the last question for today.
Okay.
Sorry, thank you all so much. I was wondering about more specific strategies. I know you all implement training. I think, is your focus more on conflict mediation maybe, and understanding teaching people to approach situations more peacefully? But I was wondering, just in general, what other more specific approaches that you all are implementing? Do you all assist with, maybe helping people get employment, job navigation, or what else you all are implementing?
So as the work, I wanted Brother Billy and Rodney to talk about the work, the wraparound services they provide the participants. You want to talk about that?
Yeah. So as in the outreach worker role and the case manager's role deal with the wraparound services. You build a relationship with them, and you see what specific needs they need. It could be educational, it could be housing, it could be substance abuse, or it just could be mentorship, or those things. That's why the outreach worker is critical. When I spoke on earlier, they train to change the mindset of highest risk, but you do that by getting buy-in and relationship-wise. But we get them there, then we pass them over to the case manager, who give them, refer them to the services they may need.
That's pretty much it. Wrap it up.
There's a saying that the guy named Kenny Ruiz used to say in Chicago, he said, relationships don't transfer. Meaning, it's hard for me. A lot of times we'll have a behavioral health specialist or a clinician will say, we need referrals, and so definitely we want to do therapy with your folks, right? But if I then vouch for you, that's putting my credibility on the line. And if they go to you and then you treat a person poorly, it's a problem, right? And so what happens, and what's happened more recently, is the outreach worker then really begins to now work a little bit more with the case managers, the behavioral health, really is saying also with them, like, I need to educate you on what's happening, right? And so they become a value learning source for folks about, how to have best practices with the population that might be high risk, right? Because let's face it, there's not a lot of clinicians out here who are trained in how to deal with some of the stuff that folks are dealing with in the streets, right? So I wouldn't send a lot of folks to some therapists anyway, but let alone, people who are out here who are struggling really and have had what we call complex trauma. But sometimes it's even deeper than that when you pull in the juvenile justice system, the criminal justice system, and the harm that has been historically created. So the outreach worker then can be a powerful bridge in that way to make those connections and also even develop their own skill set. And so, we tend to really support, how do you make that bridge making, how do you build out those maps in communities in a very strong way. But other things that are part of the session include the red flag training, which looks at how intimate partner violence plays a role in, some of the street outreach.
Working with reentry,
dealing with reentry, understanding, working with the police or the roles of, I wouldn't say working with the police, I say the roles of police.
Professional expectations.
Okay. And professional expectations, right? Dealing with that, dealing with things like the law period, understanding, like what's happening currently with the state's attorney and what are some of the things that are going down with that. So we do other stuff like that too that are part of the academy. All right.
And I want to say I love the direction in which this field is going, because it's a lot of, it's like they said earlier, it's not enough of us at the table making the decisions. We know what our hood and what our communities need, and a lot of people that's at the top that's making those decisions have no idea. But they keep us away from those tables because we may not have degrees and that college. We have college degrees in the streets, but that's not enough. So like Benny Lee, like Vanessa, Troy Martin, they got me, Troy Harden, they got me back in school, and I have my degree within the next year, and I'm not gonna stop, I'm gonna keep going. I'm gonna be at that table helping to make some of those decisions.
You all give the panelists one more hand clap, please. All right.
Thank you.
So we're going to be transitioning to the main room for our closing. So everyone, can you please make your way to the main room? Thank you for your time.
I think y'all did pretty good.
The closing will be starting at 3:15, but please make your way to get your seat.
It's always a Delta in the room.